right, let's dive into one of the most crucial, high-stakes skills you'll ever use as a clinician, the newborn assessment. We're talking about that very first critical hour in a brand new life. What you see and what you do literally sets the stage for everything that comes next.
So, picture it. You're right there in the delivery room. A baby is born. The clock is ticking. You've got about 60 seconds to get a clear picture of how this little one is handling the massive transition from life inside the womb to the outside world. So, what's your first move? What's the very first thing you're looking for? Let's break it down.
Here's the game plan for our explainer. First, we'll hit those critical first 5 minutes and the APGAR score. Then, we're going to put on our detective hats for a full head-to-toe investigation. After that, we'll get visual and map out exactly what's happening when a newborn systems sound the alarms. We'll also clear up the crucial differences in jaundice and then wrap it all up with some safety points you just can't miss. You know, those first 5 minutes, they are everything. This is where we get our first bits of data, our initial snapshot of how well this baby is adapting to life on the outside. And the main tool we use for this? It's the APGAR score. The APGAR score is really elegant in its simplicity, but so powerful. It's a super fast assessment we do at 1 minute and 5 minutes after birth. We're looking at 5 key things, and each one gets a score from 0 to 2. So first up, heart rate. Is there one? Is it slow? Or is it over 100? Good. Next, respiratory effort. Are they breathing at all? Is it just a weak cry or a good, strong, vigorous one? Then, muscle tone. Is the baby limp or is there some flexion? Or are they moving actively? After that, reflex irritability. You know, when you suction them, do they do nothing? Do they grimace a little? Or do they cry right away? And finally, skin color. Are they blue? Maybe pink in the body, but blue hands and feet? Or are they pink all over? Now, here's the most important part. This score isn't just some number we write down. It tells us exactly what to do right now. A score of 8 to 10? Awesome. We just support the baby and let them do their thing. But a score of 4 to 7? Okay, that means we need to step in. We're going to stimulate them, maybe rub their back, maybe give them a little oxygen. And a score of 0 to 3? That's an all-hands-on-deck emergency. This baby needs full-on resuscitation. The score directly tells us the level of care they need. Okay, so once we're past those first few minutes and we know the baby is stable, it's time for our detailed physical exam. I want you to think of this like you're a detective. Every single bump, every color, every little reflex, it's all a clue to the baby's overall health. So let's start at the top, the head. You might see a head shape that looks something like this. This is called molding, and while it might look a little startling to new parents, it's totally normal. It's just from the pressure of squeezing through the birth canal. The key thing to know and to tell parents is that this usually goes away all by itself in about 72 hours. But we have to be able to tell the difference between normal molding and a couple of other things. On the left, we have caput succedaneum. That's just a bit of swelling or edema in the soft tissue. On the right is a cephalhematoma, which is actual bleeding between the skull bone and its lining. Now, for your exams, for your practice, here is the one thing you have to remember. A caput crosses the suture lines of the skull. A cephalhematoma does not. That one single finding is how you tell them apart. It's that simple. Okay, let's move on to the umbilical cord. This little thing is more than just a leftover. It's a diagnostic window. You always check for 3 vessels, 2 arteries and 1 vein. Just remember AVA. So why does this matter so much? Well, because a 2-vessel cord can be a red flag. It's linked with a higher chance of things like intrauterine growth restriction or even other genetic issues. We also make sure that clamp is on tight, and we teach parents to keep an eye out for any signs of infection, like any oozing or redness. All right, now we're going to get into the really deep stuff. What happens when things start to go wrong? We are going to visually map out the why behind 2 of the biggest newborn emergencies, cold stress and respiratory distress. Understanding this chain reaction is absolutely critical. So what is cold stress, really? It's so much more dangerous than just being a little chilly. See, unlike us, newborns can't shiver to warm up. They have to use this special stuff called brown fat. Think of it as their own personal high-energy fuel pack. But here's the problem. Burning that fuel uses up a massive amount of oxygen and energy, and it diverts it away from the most important jobs, like running the brain and keeping the heart pumping. This chart right here, this is the whole story. It perfectly shows the dangerous domino effect that happens inside a newborn's body. This is our visual map. We're going to follow the path from a simple drop in temperature all the way to a full-blown metabolic crisis. So let's walk through it together, step by step. Okay, here we go. Step 1.
The baby gets cold. Instantly, the body tries to save heat by clamping down the blood vessels in the hands and feet. That's peripheral vasoconstriction. Step 2, because of that, less oxygen is getting to the tissues. So the body tries to compensate by making the baby breathe faster, which just burns up even more oxygen. You see the problem? Step 3, the body can't keep this up. The cells are starved for oxygen, so they switch to their emergency backup plan, anaerobic glycolysis. But this process is super inefficient, and it creates a nasty byproduct, lactic acid. And that leads to step 4. All that acid builds up and causes metabolic acidosis, a really dangerous drop in the blood's pH that can lead to total system failure. That right there is the why. That's the whole reason keeping a baby warm is so incredibly important. So, what does all that internal chaos look like on the outside? These are the red flags you have to be able to spot instantly. Nasal flaring, where the nostrils literally flare out as the baby tries to suck in more air. Expiratory grunting, that little sound is the body's attempt to keep the tiny air sacs in the lungs from collapsing. Retractions, where you can actually see the skin sucking in between the ribs. And seesaw respirations, when the chest falls as the belly rises, they're not working together. These are all signs that baby is working way, way too hard just to breathe. This quote from our source material really just says it all, doesn't it? It's not just about being cold. Cold stress literally hijacks the body's entire energy supply, pulling critical resources away from the brain and the heart. It is a direct pathway from being cold to a complete metabolic and physiological collapse. And that's why keeping a newborn warm is one of our absolute top priorities. Okay, let's switch gears a bit and talk about another really common, but potentially very serious newborn issue, jaundice. This is all about a buildup of something called bilirubin, which comes from the normal breakdown of red blood cells. Now, not all jaundice is created equal. And the timing? Well, timing is everything. This slide is so important. Physiologic jaundice is the common kind. It shows up after 24 hours of life. You can think of it as the newborn's liver just taking a little time to get up to full speed. Pathologic jaundice, on the other hand, is a major red flag. It shows up within the first 24 hours, and it signals that there's probably some underlying disease process going on. That 24-hour mark, that is the bright, shining line you have to remember. So how do we deal with jaundice? Well, the two biggest things are hydration and feeding. Getting the baby to eat early and often gets their gut moving, and that's how bilirubin gets pooped out. And hey, look at that third point, prevent chilling. See how it all connects back to that cold stress cascade? If a baby gets cold, they can become acidotic, which makes it even harder for the body to get rid of that bilirubin. It's all connected. And then, of course, for higher levels, we use phototherapy. Okay, let's bring this all home. Beyond our immediate checks and assessments, our job is to make sure that baby stays safe and that the parents are ready to go home. And this is where our teaching is just absolutely vital. If you remember nothing else from this explainer, please remember these 5 core priorities. Number 1, keep that baby warm to prevent that whole dangerous cold stress cascade. 2, make sure their airway is clear. 3, prevent hemorrhage with a vitamin K shot. Newborns can't make their own clotting factors yet. 4, prevent infection. Good old-fashioned hand washing and proper cord care. And 5, promote bonding. The power of skin-to-skin contact, you just can't overstate it. And here it is, one of the single most important safety lessons we can ever teach a new parent. It seems so obvious, but you have to say it clearly and directly. Never, not even for a split second, leave an infant alone on a changing table, a couch, or a bed. The risk of a tragic fall is just way too high. And that kind of leads us to our final thought here. As clinicians, we get really good at spotting the physical dangers, right? The respiratory distress, the jaundice, the signs of infection. But what do you think is the single most important conversation you'll have with those new parents before they walk out the hospital door? Is it about feeding schedules? Is it about safe sleep? Or maybe, is it about giving them the confidence and support they need to know that they can handle this incredible new life? That's something to think about.